Assalamu alaikum, everyone. Welcome back to another episode of the Medical Talk. Today we have with us Dr. Ahmad Rehan Khan. Dr. Khan is currently working as an assistant professor of psychiatry at the Virginia Tech School of Medicine. I'm very honored to have him here today with us. Thank you so much for joining us.
Thanks a lot, Dr. Paracha. Thanks a lot for giving me this opportunity.
Thank you for coming and agreeing to do this interview. I'm sure that this will help a lot of people. We usually start the conversation by getting to know you a little bit. And where were you born and raised? What was your early education like? And to understand your journey through life and how you got into med school.
I was born and raised in Lahore. I'm from Pathan Mohammedzai family, but our ancestors moved centuries ago from Afghanistan to India. And my ancestors were living in Ludhiana, the Punjab part of India. And then after partition, before pre-partition, they moved to Lahore. So I don't know Pashto much, but of course, born and raised mainly as more so a Punjabi. And I did my initial schooling at Cathedral, where Wasim Akram actually did his schooling. And then later I joined Divisional Public School in Model Town. And from there, I went to Government College University and got that so-called Ravian tag. And that really helped me because there were people from all over Pakistan there. And uh, I did really good in my FSC pre-medical part one, especially I was among top 6, 7 students in the whole province, but didn't do so much in the part two and entry test. So uh, ended up in SIMS as compared to King Edward or AIMC, which seemed like a plausible target at the time. And then I joined SIMS. It was a wonderful experience. The good thing about my college was that it was attached with Services Hospital, and it is one of the biggest tertiary care hospitals in Punjab, in Lahore. And the teachers, especially the clinical sides, all sorts of subjects were taught by very seasoned professors. So that really helped us a lot.
How did you decide that you wanted to pursue psychiatry?
There were a few factors. So during our second year of med school in Lahore, there was a terrorist attack. That place wasn't very far away from our med school, and actually we could hear that attack. And though we were in second year, after that there was an emergency called all over the province, and people were brought in for the treatment. So actually, I was one of those who volunteered to be in the ER. So during that time, I realized that they were actually treating their physical conditions, but there was not a lot of focus on the psychiatric or mental health aspect of the trauma. I could actually see the fear in their eyes for the very first time, that I could actually see a clear fear in the eye of anyone. And then with our psychiatry department, we did some volunteer work for those trauma victims, and it started from there. And then, of course, my grandmother was very close to me. She developed multi-infarct dementia. We used to call it multi-infarct. Now we call it vascular dementia. So she developed that, and I could see her cognition, neurocognitive decline. And even at that time, though Lahore is the second biggest city in Pakistan, but we could not find that much help for her. So that also, you could say, the final nail in my, I shouldn't say coffin, but in my, it was the final push towards my decision to opt for psychiatry or neurology.
I think in Pakistan there is a stigma attached to psychiatry in itself, and I think it's very important that people go towards that specialty so that there's more acceptance of psychiatrists and psychiatric problems. So after medical school, you pursued your residency in the US. So what was your match experience like?
What happened was that nowadays the students like you and other students, they are very well prepared, and they have really good guidance, and they take their exams during the med schools. We, unfortunately, being a new med school, we did not have much of that, and also it was our laziness that we did not reach out to enough people. So I did not do any of that. So after my graduation, I did my house job, internship in Services Hospital. That was a wonderful learning experience as well. And after that, I started preparing for my exam. Now, my father, my family, they supported me financially a lot, as much as they could. But I was someone who thought that I could not just sit home and study. So right after uh, leaving house job, I started working for Farooq Hospital in Westwood in Lahore as a medical officer. I worked there for some time. After that, I started working as a medical officer. Uh, sorry, there, and then also did some worked in DHQ Kasur, and then finally I joined Shalamar Medical College as a demonstrator. So during all that time, I was working. So I did work and prepared my exam. I did not score that well in step one. Got a little bit disappointed, but then had some encouragement from friends and family members. Did reasonably well on CK. During the same time, I got in a fight with my wife, who also started the journey. So actually in 2014-15, we went to US to do some rotations together. We made wonderful friends. There were a lot of people who really helped us in our journey. I think, and we both applied to that match. What happened was, I think, again, my efforts were misdirected at that time. And again, the primary blame would be on me because I should have strived harder to get that guidance. So both of us applied, but unfortunately we did not match. Um, it was a very difficult time because now, I mean, we had both taken our FCPS Part 1 exams, we cleared it, but of course, the aim was, especially for me, since I knew that the psychiatry training in Pakistan was not that advanced. I must make it clear that there are wonderful psychiatrists in Pakistan and training is very rigorous and it's very good. But I think some of the things which I were interested in psychiatry, uh, oh, like neuromodulation, ECT, TMS, they were not that common in Pakistan. So that's why I had hope that I would pursue it in US. So that was a difficult time because we did not have enough finances that both of us could go again. And my wife actually sacrificed. She stayed in Pakistan, in Lahore, continued to do her job, and I went there. Uh, so I went from 4 interviews in my first season, math season, to 20 interviews in second. And I have told this to a lot of people that my year of graduation, I was older, graduate by 1 year. My scores stayed the same. I had already taken step three. So other than a well-guided approach towards match, finding some good rotations, and most importantly, very good mentors. So that was something that helped me tremendously.
You talked about direction and that you were a little misdirected during the first time. So, what did you do differently in the second time, and how did you approach mentors? Because I think in Pakistan, generally, medical students hesitate when approaching people who are working in the US. So, how did you approach the mentors, and what did you do during that time period to improve your CV?
I think what happened was you're absolutely right, and that's what I encourage people to reach out to mentors. And a lot of time we don't know how to reach out. And I also learned that to start with, there has to be a very formal way of approaching someone, like dear doctor and last name. And I did not know that because in Pakistan we don't say dear, we don't say doctor, we say sir, madam. And in US, of course, people don't like that. And I had some bitter experiences initially, but those bitter experiences helped me. So I reached out to, and then most importantly, again, a message for students, reach out to people in your field. I get messages, 20, 30 messages per week from people who are not in my specialty. And I have been involved in mentorship for applicants, for students for a long time. So I know, in addition to psychiatry, I know about neurology, medicine, so I can guide them a little bit. But uh, maybe someone might not feel that way, and sometimes they get offended. So that is also important to reach out to right people, and that's what I did. I reached out to right people. I would like to mention some names: Dr. Mohammad Zishan, Assistant Professor of Psychiatry at Rutgers, uh, Dr. Ali Hashmi from Lahore. So they were those people who really helped me. And I was also very lucky that I found good rotation opportunities that really helped my case. Then the further things which I improved was my personal statement. I think personal statement played a significant role in that transformation. And also ERA's CV. You can have double 250, 60s, even 270s. But if you don't do well on these things, it would always be a deficiency in your part. At the end of the day, God really helped me, and I was able to get match in my top four.
You mentioned personal statement and the ERAS CV. So, what are your suggestions for people regarding both of these things? Because recently on Twitter, a lot of people have been tweeting about how they're finding it very difficult to write a personal statement and put all of their thoughts on paper. So, do you have any advice for people regarding that?
I think there are a few steps. One step is acknowledgement. We should all acknowledge we have different backgrounds.
Yes.
Maybe if I was raised in an environment where people did speak some English, my English would be, again, I'm not saying I was, I'm saying someone, then his or her English would be different as compared to some other people. So we have to acknowledge that, we have to we have to accept our limitation. And most importantly, English is not our native language, especially the US English, which is different from British English, which we have been taught throughout our life. It's not a big deal. We don't have to develop an accent. We don't have to develop out of nowhere. We don't have to develop master level English skills. What we can do is we can try to learn. So I think the best suggestion would be to start early. If you are applying for the match in September, you should start no later than January and February, even to just to start making a rough draft. So there are a few components. One component is story, that there has to be a story about yourself in your mind. And then the next step would be to translate those thoughts into words. So it's a long process. You write, you ask people, they review, they point out mistakes, you write again. So it maybe at the end of the day, it's like 20, 30 revisions, but two key components about personal statement. I was actually yesterday having conversation with one of American medical graduates who's in her fourth year. So personal statement, the word itself has two components. Personal, it means it has to be personal about you. It has to be unique experience. And the second is statement. It has to make a statement about yourself. If a personal statement, when a reviewer start reading the statement, and if that statement hits him or her hard, they would be compelled to read the statement the entire length. So that is very important.
Yeah, I've seen a lot of tweets from people who are mentoring people in this math cycle, and they have mentioned multiple times that you don't need to write very fancy sentences. They just need to be true to yourself.
Absolutely. And again, I was under the same impression as well that you can go to thesaurus, you can open dictionary, and what we do is we end up making it a word salad, which does not give a good impression. It could be simple, and yet it could reach the people who are reading it.
You have talked about visa issues that you faced during your entire residency journey. So I think a lot of medical students have this confusion in their minds that what are the visa types that are available for IMGs from Pakistan, especially. If you could just give a brief overview of that.
The most important for most students would be B1, B2 visa, which of course they can apply while you are a student. That's the best time still to apply. What you can do is you can apply for electives. You have to have a specific elective letter, acceptance letter from a university, and with that, there are higher chances that they would accept. But I mean, exceptions are always there. So that is something that a medical student can do. It is important to remember once you graduate, you would not be able to do electives. They used to have an exam called clinical skills. Most of us, including myself, we applied for that because it used to take place in US. Because since they are not asking people to take that anymore. The best way would be either to apply it during the med school for electives. The second way is you take your step one, you take your step two, you apply on the basis of step three, which again still can only take place in US. So this is the only kind which a student or which anyone before applying residency can apply for. It's B1, B2. And after you are selected for residency, then there are different types, J1 and H1.
So what is the difference between J1 and H1? Just a brief overview.
So J1 is known as exchange visitor visa. So if you do your residency and then fellowship on J1, you can work on J1 for 7 years. After that, technically, irrespective of the fact if you are a doctor or student or engineer, you have to come back to your home country for 2 years, and then you can apply for visa. For doctors, they have given special allowance that you don't have to go back to your country. You can work in a relatively underserved community for
Mm.
3 years on H-1B visa, and then your going home requirement would be eliminated.
Mm.
And they say it underserved, but most of the places in US, a lot of places in US which offer that visa, they're pretty reasonable cities. And depending upon the specialty, like psychiatry these days, you can get J1 waiver even in New York City. So H1B is different, that you don't have to come back. There's no requirement. You don't have to do waiver. If you do a 3-year residency, 4-year residency on H1B, your next job, you can start working as a consultant. They can apply for your green card if they feel so.
Okay. Thank you so much for explaining that. I think a lot of people are confused about the different kinds of visa, so that helps a lot. What were the issues that you faced during your visa process?
Absolutely. So first of all, again, I would like to say that I'm still very thankful to United States government and State Department, because I'm still sitting here and talking about my issues, despite of having those issues. So I think that depending upon your story, some people, when you apply for electives or stuff, some people get 5-year multiple entry visa, some people get 3 months, 6 month visa. So I got 6 months for the first time. It was smooth. Then I got 1 year multiple, and the third time I applied, I got 5-year multiple. So that was fine. Uh, and then once I got accepted into a residency program in J1, that was the first time they did delay my visa for 7-10 days,
Mm.
but they gave me. So that was again fine. Uh, the problem started during my third year of residency. Me and my wife, because my wife is also a psychiatrist, so we both came to visit our home country. We had a daughter at that time. So they approved my wife's visa, but they placed my visa under administrative processing. Now
Okay.
I thought that it won't take more than a couple of days or weeks, because I was already working here, but actually it did take 3 months. So that was very difficult. 3 months, my wife had to go back with my daughter. She was alone with daughter doing residency as well as handling everything else. Of course, we were just relying on one salary, because again, that 3 months I was not getting paid for the whole 3 months. Uh, and I think the emotional turmoil was a lot, because my daughter started to walk. She was very attached to me even at that young age. So it was a very difficult time emotionally, financially, as well as from a career standpoint. Finally, I got my visa back, and so I was out of cycle. So I did not finish my residency along with the rest of my class. Due to that, I could not be considered to become a chief resident. I had very bright chances. I Because I became off cycle. So a lot of opportunities that I could have availed, I could not. And it did not end there. So after finishing my residency, in order to convert my visa, I traveled Pakistan again. I was very confident, because during the same time I had volunteered for US consulate in Lahore, which is State Department. And if you still go to their Facebook, Twitter, Instagram pages, there are my videos on mental health awareness with almost 40-50,000 views. So I was confident that this would, and my lawyer was confident as well. I had signed a contract with my current employer. I went there, but unfortunately they did it again. Uh, and some of the people who have been to embassy, they don't give you a reason.
Yeah.
So this time actually, I had two daughters, and it was again very difficult. And this time it took 4 months. So it was very difficult because it took 4 months. The frustration, I run out of words, a lot of time to explain that. So yeah, it happened. And but finally, yes, they released my passport with the visa, and I came back.
I think you were persistent and dedicated throughout, and that is what is the most important thing. And all of us should learn from this as well, because obviously there will be hardships, even if you're staying back in Pakistan. I think a lot of people have this perception that if you are going to the US for residency and if you get a spot over there, everything is like a fairy tale and everything is perfect over there. But I don't think that's the case. It's about
Well,
dedication.
there are a few misconceptions. One thing is everything is fairy tale. Some people also think that there are dollars on the trees which we can just grab. So yeah, no, it doesn't work like that. There are a lot of difficulties. For instance, you cannot have maid services readily available here. So you have to do everything from cooking, from changing diapers. Both male and female, irrespective of that, should do that. uh, uh, Cleaning your toilet and everything which neither male nor females are used to do in Pakistan.
Mm.
So there are a lot of hardships, and I always say that it all starts for most of us with a big old American dream. We watch their soaps, TV shows, we watch Friends, and I'm actually holding the cup right now. We watch these TV shows, movies, and we think that everything is like a Cinderella story, but it's not. There are a lot of hardships. But again, at the end of the day, if you are persistent, you keep working hard, then eventually you will get there.
I think that's very important. When you talked about your second match cycle, you had US clinical experience. So, what is your advice to students who want to have US clinical experience while they're in their medical schools? Because I think after COVID, it's even more difficult to get a spot at a good university hospital in the US. So, how do you think they should approach people for a good spot in their specialty of choice?
Absolutely. There are no doubts that COVID has changed so many things, and pre-COVID and post-COVID circumstances for international medical graduates or IMGs are not even comparable. I think what you people can do and what I would always encourage is if you can, because step one is pass fail now. If you can take that step one during your first 2 years of your med school, or at least in your third year, a lot of places that do offer electives, they would require you to be at least passing that step one. So that is very important because a lot of time, and it's not a mandatory thing, you can still get it, but your chances get high. I think what you can do is you can build a CV, and you can take your step three and start emailing people. You can go to freda, that tells you about different residency programs. So those residency programs, most of them have elective opportunities for international grads, at least some of them. So you can start emailing people. Most of their emails are on their websites. Again, you have to keep your expectations low. If you email 100 people, it's possible only a couple of people, two, three people. So the rule is if you email 100 people, maybe six, seven will reply. Out of those six, seven, 40, 50, 60% would say no. Maybe one or two out of 100 would give you a positive response. Or even with that positive response, there is no guarantee that you will actually get it. So you have to be very persistent about it. And I know even when we were doing it, it creates a lot of frustration, disappointment. But again, the name of the game is persistence and desire to never lose hope.
You also talked about mentors and how they changed your career pathway and helped you a lot during your math cycle and during your residency. So, how do you think that people can find good mentors? And also, you're working for APPNA and PAPANA. What has that
Yeah.
experience been like? And when did you start working actively as a mentor?
I started right away in the first year of my residency. I was trying to help my juniors from my med school and all other med schools because my wife is from King Edward. A lot of people from King Edward would reach out to me. And because a lot of people from King Edward, Nishtar, Aga Khan, Daw, from every medical college helped me during my time. So I was trying to help them as much as I can. So now we have some forums like Papana is specifically for psychiatry. I would encourage all of the students who aspire to take steps, even specifically for psychiatry, and even if they are not targeting psychiatry, because we do workshops, webinar on personal statements. We invite program directors. All of our webinars have at least couple of program directors, three, four even at times. Even sometimes we invite program coordinators. So they should become member of Papana. The membership is free. The second thing is APNA. So APNA, I'm part of APNA YPC. YPC is Young Physician Committee. They have done a tremendous amount of work for young graduates and especially even medical students. They should join their Facebook page for updates. Third thing would be you have to find a mentor that can actually help you. And again, the way would be you can reach out to them, you can send them message, even on Facebook, if you can find their email, but it has to be a very formal message. I must say that if a mail is approaching to me, I know a burning desire to say Ahmad Bhai, Rehan Bhai for a mail, which we also used to do. But again, if it's just me, I want mine because people have been working in US for years and years, so they have become acclimatized to doctor and last name. So dear doctor and last name is the way to go, irrespective if it's a female doctor or a male doctor. Dear Dr. Khan, dear Dr. Paracha, I hope you're doing well. So that has to be the way. And again, if you reach out to enough people, you will find a mentor.
Moving on, after the ERA CV and all of the applications are submitted, we have the interviews. And I think that's a very big part of the application because you're meeting the program directors. So, what advice do you have for people when it comes to the interviews?
Again, both Papana and APPNA are holding webinars for that. For example, APPNA YPC is doing one, and we have invited 4 different program directors, and one of the moderators is also program directors. So I think these webinars would be helpful, and especially again, COVID has changed so many things. Now it's virtual interviews. So I think if I have to give example of virtual interviews, there are many things to notice. So again, your appearance, lighting, sound quality. You notice that I was wearing glasses. I took them off because the light was glowing on that. So these small things can be very important. And also be aware that if you are giving a virtual interview, just imagine that you are actually giving an interview. It has to be very formal. You should not be wearing in your shorts because a lot of things can happen. You have to get up, and they would not like seeing someone in their shorts. So things like that. And I think then the general things which apply to interview, that you have to go prepared. If you're interviewing for a program, you should try to know as much as you can regarding that program from websites, from people, if you know someone there. And then you have to ask pertinent questions. Don't ask things which are already given on their websites. They won't like that. So you don't have to ask questions for the sake of questions. Ask pertinent questions, make good eye contact, post interview email to thank PD and coordinator, and showing interest in the program would also help.
Apart from the interviews, there is the supplemental application as well. So, could you talk a bit about the supplemental application and what applicants should include in that?
Yeah, and again, so both Apna, YPZ, and Papana did a webinar on that. So it is something that is even new to us. They have started that you can signal some of the programs. I think there are 5, uh, and you can write your meaningful experience in a few words. It can be very helpful for some people if they can signal a program. They feel that they have higher chances of matching. They like the program. Uh, so yeah, again, it is a new territory, alien territory even for us. We are also learning about that. So I think anyone who really wants to learn, seeing that webinar videos on our YouTube channel, Papan or Apna, or our Facebook pages, Twitter profiles, that would be very helpful.
I think everyone should join both of these groups. I have joined them and they're very helpful. There are webinars, and I'm in second year right now, but they're very helpful for me as well. So I'm sure that match applicants can gain a lot of advantage from those. Dr. Khan, you mentioned your journey in the US and your journey through residency, the struggle and the hard work and the persistence. Do you think that you achieved the kind of training you wanted?
Absolutely. I think every minute, every second of it. Uh, Not only I have learned a lot, and it has made me a better physician. I think these even adversities. I was telling Dr. Tariq during a YouTube session that it has made me a better person. A lot of time you face adversities in your lives, and you sh- it I mean it can mess you up, or if you survive that, it teaches you a lot. So I think that uh, we should try to learn from our mistakes and the difficult circumstances which we face. I feel that these experiences, good or bad, have taught me a lot. And today I do feel that I'm a better physician, and at least I try to be a better person.
Yeah. I think you're a role model for all of the people who are applying and want to become a better physician and make an impact in their patients' lives as well. Do you have any advice for the medical students who are watching this podcast?
Yeah, so advice would be plan early.
Yeah.
I know that sometimes it's difficult to plan, but you have to have an open mind. Again, US is not the end of the world. A lot of time people reach out to me that I have failed an exam and stuff like that. Despite of failing exam, despite of visa problems, if you have made your mind that you want to come to US, with whatever the reason is, if the reason is legit enough and you have made your mind, you work hard enough, you would eventually get there. But again, the pathway can be very difficult. It can be painful. So you have to keep that thing in your mind that you should be prepared to endure all those difficulties. I think first of all, made up your mind what you want to do. clarity, and then just start working on that. Because as soon as you can make up your mind, the things would line up and things would start to become easy for you.
That's great advice. Thank you so much for joining the podcast. It was truly an honor. I have been following you for a while now because of APPNA and your posts, and I've learned a lot through this session. And I hope that we can have you again soon. And thank you so much for joining us.
Pleasure is all mine. Thank you.